Good evening once again. This is Julius, and let's recap the basic abdominal examination. The first step is to introduce yourself, and before you do that, you have to ensure that you have washed your hands and donned the right PPE. Then the second step involves introducing yourself, like mentioning your name and your role and why you are doing the procedure. It's also important to confirm the patient identity, like the name and the date of birth and the first line of address, just to avoid confusion, and explain the procedure correctly to the patient, like what you're supposed to do, gain a consent and perform to proceed with the inspection or the examination, and explain what it will involve. Especially it will involve the exposure of the abdomen, and you have to ensure that the patient is lying on supine position and the bed is at an angle of 45 degrees. So while standing at the end of the bed, you have to inspect around the bed for surgical drains, stomas, and medications that may be on the table or maybe the patient is using. The second step is to perform a general inspection of the patient, noting any discomfort, jaundice, or pallor. This is just by direct observation. Inspect also the hands for clinical signs like palmar erythema, finger clamping, koilonychia, and tremors. Sometimes it is also important to inspect the axilla for clinical signs, noting excoriations, bruising, hair loss of the axilla, as these are really important because they could indicate diseases that are underlying. Also palpate for the radial pulse, like ensure you are able to assess the rate and the rhythm. Then you proceed with inspecting the eyes, the mouth, and the face. When inspecting the face and the eyes and the mouth for clinical signs like corneal arcus, this is the round circular white region that has a mark on the eye, and the altema is the raised elevations above the eyelids, and also jaundice is the yellowing coloration of the sclera, and glossitis like a beefy tongue, where the tongue, sometimes you have to tell the patient to open the mouth, and you can inspect the tongue for glossitis and things like that. Also, when you're talking about the mouth, you can also talk about angular cheilitis. Is the specific wounds or types of wounds that can happen on the angles of the mouth. And also, if you tell the patient to open the mouth, you can also inspect for things like aphthous ulcers. The next step is to palpate the neck, and you are palpating the left